We have another interesting patient. The patient had a posterior shoulder dislocation about a year ago and still has some symptoms with overhead movements. Now, when we look at his active movements on the good side, he has approximately 53.8 degrees of medial rotation. He has approximately 25 degrees of horizontal flexion. When we do the same movements on the other side, he only has 10 to 15 degrees of medial rotation. And if you look at his horizontal flexion, he only gets to 0. So in his case, he would have the hypothesis that his symptoms might be caused by a posterior laxity. To confirm this, can you lie supine, please? We could again do the apprehension test. Now, with the apprehension test, he may describe symptoms. Now, I want to differentiate. Do these symptoms come from subacromial impinging due to posterior tightness, or do the symptoms come because he is subluxing? To do that, I do the relocation test. Part 1, I push the humeral head forward. He has symptoms, and he gets to around 85-90 degrees of lateral rotation. Now I do the relocation maneuver, and he describes exactly the same symptoms, and I get only 5 degrees increase of lateral rotation. This would confirm the hypothesis that the symptoms are not being caused by an anterior laxity, but maybe by a posterior tightness. To then confirm posterior tightness, I check horizontal flexion. Again, he has only 0 degrees of horizontal flexion. I confirm the medial rotation. He has 15 degrees of medial rotation. So now I have to do specific tests for posterior tightness. Specific test for posterior tightness, I palpate the humeral head, and I can feel that as I medial rotate, that the humeral head is sliding anteriorly. That would confirm posterior tightness. Then, as a final test, I do the posterior drawer test, and although he originally dislocated his shoulder posteriorly, now actually his posterior drawer test is limited. So these examples, I hope, show that you don't only go for one test, but you have to go for the clustering of the whole test in combinations.